Now it's time that we all share our love. In the eyes of a child, a helping hand, a friendly smile, reaching out to those who need a world vision of God's love and charity.
Nalinya Health Center 3 serves a population of over 800,000 people, many of whom are women of reproductive age and children. For the past 10 years before 2012, Nalinya Health Center did not have a midwife. Mothers moved a longer distance in search for the nearest medical health center. Traditional birth attendants remained popular even though they operated illegally.
Ogusooka twazaaliranga wano e Kiboga kubanga wano emulagi tewaliwo abazaalisa. Ndina abaana bange bataano, abasatu nabazaalira Kiboga, owookuna weenyonsa namuzaalira emulagi nga bamaze kudusindikira abazaalisa.
And because so many mothers were going to the TBS, some of them would have medical complications that like overbleeding after labor. Some of them lost their babies, some of them even lost their lives.
Abakyala baffe basanga obuzibu bunene nnyo okuzaala nga bazaalira mu kyalo, nga bazaalira ku bitooke, abalala nga bagendako kalimba mulirwa naye abatalina bukugufu mu kuzaala kw'abaana. Kati nga twasanga ekizibu kinene nnyo, abaana baffe ne bafa nga bazaalibwa, bamama baffe ne bafa nga bazaalibwa.
In a bid to seek long-term sustainable solutions aimed at improving health services and governance at the local level, the community supported by World Vision in Kiboga district employed a local-level advocacy approach known as the Citizen Voice and Action to address their challenges. Through the approach, the community identified and prioritized challenges that needed to be addressed first using the cheapest and sustainable solutions. This was done by encouraging increased dialogue and accountability between citizens, service providers, and the government. Using the approach, the community undertook a series of actions to ensure recruitment of a midwife despite inadequate government funding at the time.
CVA is about empowering community to demand and access quality service. We do this by mobilizing the community through their local leaders, religious leaders, and CBO members.
As members of the community, we embrace Citizens' Voice and Action. In this, we came up with action for issues identified in the gathering. Notable action was to forward some of the problems chosen to be worked upon by the authorities.
Oluvannyuma bamala okubaga ekiwandiiko kyabwe ne bakireeta kugombola mu kanso ey'eggombola yennyini eya Sub County e Mulagi. Tumala okituulamu ne tulaba ebyali bisobokamu ebitonotono ne tubikolako ebyatulemesa ne tubuweereza ku disitulikiti.
Era district council nayo n'ekiraba nga kyamaanyi era naffe ne tuyisa resolutions ez'enjawulo okulaba nga tubeera n'abasawo naye ng'okusingira ddala abazaalisa. Era kye twakola twawandiika mu Ministry ya Health ne Ministry ya Public Service.
An advocacy coalition in Kiboga and Kyankwanzi district created platforms for dialogue with the district council. Using evidence generated from the community gatherings, they developed a joint statement which was presented to the district council. Through this dialogue, a resolution to immediately recruit medical workers, including midwives for Nalinya Ndagire Health Center, was made. However, with insufficient fundings at the district, these matters were presented to higher levels of authority at the national level.
Collectively, as various implementing partners in the district, we did write reports. A number of reports tend to come up, which were distributed, disseminated to the various stakeholders at sub-county level, at the district level, and even at the national level. We held a meeting with a committee on health from the Parliament of Uganda, where we discussed a number of issues, which included general health and the VHT issues. and amongst which the issue of shortages of health workers was presented to the members of parliament.
We as members of parliament in the budget conference of the district, we captured those issues and we put our foot down and we called upon the support of other MPs, and we found also they had suffered the same, and we managed to push this issue to its successful end.
The advocacy agenda at national level at the time provided an opportunity for platforms to be created where the healthy workers crisis would be addressed. The Civil Society Coalition for Reproductive, Maternal, Newborn and Child Health used evidence from Nalinya Health Center to advocate for increased allocation of funds towards the national health sector budget for the year 2012-2013. This was done by working with members of parliament who played a major role in blocking the national health sector budget until more money is allocated to this cause. MPs were met at budget conferences and during national dialogues where testimonies were shared, and also bringing the media on board helped to keep the debate in the media arena.
So we had to mobilize ourselves as members of parliament, particularly women members of parliament, to ensure that we don't pass the budget. We lobbied our counterparts, the male members of parliament, and even more people from civil society to join us to ensure that we have more funding for the recruitment of more health workers, which we did successfully.
What started as a small problem in Malaji sub-county contributed to an increment of 49 billion Uganda shillings, approximately 19 million and 600,000 US dollars towards the 2012-2013 National Health Sector budget, specifically for recruitment of health workers. 108 health workers were recruited in Chakwanzi district. This has contributed to improvement in health-seeking behaviors, such as mothers attending and seeking antenatal services. Maternal and infant mortality rates reduced to 11% and 19% respectively in Chakwanzi district.
Currently, our staffing levels are at 71%. We have 174 health workers out of 258. There is a reduction in the workload. And secondly, we are beginning to see an increase in attendance at the health facility.
Currently, we get between 80 to 100 mothers per month, and the number of deliveries has also increased. It now ranges between 15 to 20 per month, and also outreaches.
Bwemba nga ntambula okuva ewange okujja wano ku ddwaliro kintwalira eddakiika 5. Empeereza ya wano ku ddwaliro nnungi kubanga bwe tutuukawo abasawo tubasangawo era eddagala balituwa.
Although the community in Mulaji sub-county is happy to have a midwife, so little has been done to address other health challenges such as the dilapidated infrastructure, limited space, lack of clinical equipment, and insufficient commodities, among others, which continues to deter the quality of services accessed. The community has gone back to the drawing board using the citizen voice and action, a local level approach to seek solutions to some of these challenges.
We've seen changes as far as staffing is concerned, to the extent that staffing has risen up to 78%. Communities have been empowered to demand for services, not only in health, but also in other sectors, especially education.
Again, evidence is brought about as a result of CVA. We're able to again influence some international level policy processes like the Global Health Assembly, where we input to the government policy judgment using those evidences, and the resolution on life-saving commodities was adopted. All these decisions have been translated into programs at the community level. Like, for example, we see a number of projects which are coming up to improve delivery of life-saving commodities and also the increase in staffing levels, which will translate into increased sustainability.
To the children of the world, we make this vow.